So this program is for people will move in, they will enroll in the program, and they can stay here as long as they like until they find a permanent housing destination. This is a bit of a unique program model in the Health Through Housing portfolio. It's called emergency housing. I think it's a fair way of thinking about the evolution of how we think about providing emergency shelter services to people from that old school congregate mat on the floor bunk bed model that you're very familiar with. We've evolved over the years to create something where people have privacy and autonomy and can stay as long as they need to, while staff here on site help support them connect to whatever resources they need, with an eye towards, of course, a permanent housing destination.
Did I hear correctly? Is this the original Pioneer Square shelter? You shut that down, moved to Renton. Is that the dynamic here?
It's part of it. So you're correct that when the pandemic started, and as Noah explained, in order to save people's lives, we, on about a week's notice, picked up the region's largest congregate shelter, moved it to a hotel in Renton, and that proved the ability not only to prevent the transmission of COVID, but also to keep people generally safer and help people recover and help people move on to housing. What we are now doing at this location, as well as another location in Seattle called the Mary Pilgrim Inn, both operated by DESC, is the staff and the organizational capacity that went to Renton to operate that site temporarily is now going to return to Seattle between these two sites and provide those services and more. And to respond to the other question, what we're achieving at the same time is a transformation of the service model. And DESC, I think, gets a lot of credit for this. What they've been able to do is go from people sleeping 300 to a giant room to people in their own room with their own bed and their own bathroom. They can lock the door, they can get a good night's sleep, and that's a huge difference from what was on 3rd Avenue just 2.5 years ago.
Just to follow up on that, so we have now the capacity to avoid a congregate shelter, an overnight shelter now, with the rooms that are available in the county?
I'll speak at the county level, and then certainly defer to the executive if there's anything he'd like to add. We are still going to need congregate shelter in our portfolio, but it's not the place that we should be emphasizing growth. And congregate shelter needs to look more and more like hotel rooms do now. So people still need to be able to use the bathroom without signing up 3 hours ahead of time. People still need to be able to get a good night's sleep. People still need to be able to receive their mail. And so even though congregate shelter will continue to be important, especially in emergencies like smoke or hot weather or snow, what we are moving towards is a dignified system that allows people to have their own space. And I think this is a really good example of what that can and should look like.